It's almost a fantasy now to imagine Orange County just a century ago, before urbanization, before the freeways even, when most of Central and West Orange County were lowlands and marshes created by the sprawling Santa Ana River Delta floodplain. Most of West Orange County was dairy and marshland with open irrigation ditches subject to flooding and seasonal wetlands that harbored an endless supply of vector-borne insects. Most of the marshy lowlands here in central and western Orange County have been drained now. The rivers and rivulets that have perennially overflowed their banks here in West Orange County have been superseded and harnessed by a flood control system, a concrete flood control system like the one you see here in Los Alamitos. And with the elimination of these marshlands, we could assume the eradication of certain vector-borne nuisances that accompany these wetlands, namely the mosquito. And for a time, it looked like we had paved over and subdivided the worst of what Mother Nature had in mind for this area, namely marshland, mudholes, and mosquitoes. Created in 1947, the Orange County Vector Control District has done a pretty good job of monitoring and controlling what was left of our overall vector problems in OC, from rats and other rodents to fire ants, fleas, flies, and of course mosquitoes. Mother Nature has a way of adapting to the hand of man, even here in urbanized, flood-controlled Orange County. In 2004, for the first time, officials here at the Vector Control headquarters and labs in Garden Grove were able to isolate among dead birds and mosquitoes the first cases of West Nile virus, and with human cases shortly to follow. It caused symptomatic illness, and only a small percentage of those infected, 20% roughly, and the symptoms were those like flu, achiness, headache, overall body pain, that in fact went away over time. But in a smaller percentage of cases, the effects were devastating, resulting in chronic illness of encephalitis and meningitis for those unlucky few of the bite. As you enter the lab facilities of Vector Control, there is a reason for the prominent display of a poster that depicts the highest dozen or so animal threats to human life. At the top of the chart, with the least fatalities to man each year, stands the shark. And as you descend your eye down the poster through increasing threats to man, from elephants to snakes, the greatest threat and cause of death to man turns out to be the smallest creature of all, the mosquito. In 2014, now with the highest reported number of human West Nile infections in California, and for the first time with an average mosquito pool infection rate of up to 80% of tested pools, ponds, and waterways, the threat to people is, as Vector Control officials say, off the charts. Jared Deaver is Communications Director for the Orange County Vector Control and is tasked with wearing many hats in the course of a week at the height of this unusually severe West Nile outbreak season. But he takes the time here to carefully explain what makes the West Nile virus outbreak in 2014 different, and the challenges Vector Control continues to face in addressing it. Of course, the cause celeb at the moment, and something that we're getting some press on around the county, is West Nile virus. And you folks at Vector Control are on the front line of that abatement process and monitoring process, and you interface with a number of other organizations in the county. Tell us about that battle, that ongoing battle, currently underway in 2014 here in Orange County?
So 2014 has broken all the records for West Nile virus in Orange County, but we are also on pace to break most of the records for infection rate in both humans and also in mosquitoes in the state. This year, Orange County leads the case counts in humans and mosquito infection in not only the state, but in the country. And so we had early indications of the virus in June, where we started noticing a lot of our mosquito samples that we collected from the field were coming back positive and highly positive for the virus. Many dozens and dozens of birds were being collected and testing positive for the virus. Now, what we do is a multi-pronged approach for just these circumstances. We operate under an integrated vector management system. So the integrated vector management means that we start with education as being one of our primary components for resolving these disease issues with the public and also with other agencies that may not even know that they are a player or a contributor to vector-borne disease. Be like cities, their infrastructure, their underground storm drain systems, sewer systems, gutters, assets that are owned by your city may not even be aware that those infrastructure issues may be causing mosquito breeding right beneath your feet. So we work with the cities very closely to help clean out and keep those water conveyance systems moving throughout the summer months. And that's one component of the IVM program. Another component is that we have a huge crew of full-time and also seasonal employees that go out and tackle behind the scenes. For most residents will have no idea that these activities are actually going on in their own neighborhoods. We're spraying all the gutters that are holding water and tackling all the storm drains and making sure that they don't breed mosquitoes. But then also we have entirely other crews that go out and handle the rat service and fire ants. But for West Nile virus this year, having such early indications of enormous positive mosquito pools and things of that nature, we've been working even closer with some of the cities to do more for outreach and more for publication. We've developed warning signs that we've posted in all of our neighborhoods. We've asked the cities to participate in getting the word out through their community groups, through HOA, through any electronic notification systems to help us combat the virus.
It all comes together here at County Vector Control Laboratories in Garden Grove, where the empirical science of surveillance and identification are constantly informing and altering vector control's methods of interdiction and eradication. When it all works, we hardly know vector control is out there doing its job. But this year, the rising number of West Nile cases in every part of the county, but especially in Central and West County, have drawn front-page headlines, and for good reason, says Vector Control Lab Chief Bob Cummings.
We had years where we had a lot less West Nile virus activity, but this year is something that has set a record for us. And we've had this as measured by this infection rate.
That's this graph here.
Yes, it is. And we went to an infection rate of approximately 40, which is now 8 times what we consider the epidemiological threshold of concern.
And at 5, at
yes.
the epidemiological threshold of concern,
yes.
What kicks in? Well,
we can increase our control efforts. Now we've doubled our crew efforts, reducing the cycle times. What we emphasize is that we'll get back on some of the mosquito breeding sources and shorten that interval between treatment and pause and going back and retreating to maximize or minimize maximize control, but also minimize the chance the mosquitoes will emerge from those factors. Yeah. But also it allows us to go into other strategies. It's a permissible level at which if agency wants to go to fogging or go to aerial spraying, these are the factors or measures by which you become justified to take on these other control strategies.
Well, it looks like by this graph, by this summer's outbreak graph,
yes.
that this light blue graph, that's this 2014 summer we're
yes.
looking at now.
Yes.
That you're way, way above that 5 threshold.
Yes, that's what was concerned. We saw this developing earlier too. If you see it in the month of July, looking at that casually, we looked like a threshold of 13. We knew that the mosquitoes had a high infection rate and that the prospect of human cases was coming down the line. Mm-hmm. And this is where we devised some strategies of alerting the public through the news media and also through community groups that we knew a big West Nile virus event was coming, that this was going to be a bad year. We saw that actually all the way back in June.
You could see it coming.
Yeah, we could see it coming. We knew this a month to 6 weeks ahead of this onslaught of human cases.
Ask any man or woman on the street in Orange County where they think most of the West Nile infected mosquitoes are breeding, and you'd get the common sense answer: in open drainage ditches or along lake ponds, remaining riverbeds. But according to Chief Vector Tech Bob Cummings, they'd be wrong.
That's not what we see. That's maybe the conception people have. But actually our #1 vector for it is what we call the house mosquito. And that mosquito likes to bite indoors and also breeds around homes and also around urban areas. It's in the gutter water, it's in the water in underground drains, it's what will breed in a bad swimming pool or a bad pond or a small container. So this mosquito is what we call a domestic mosquito, in that it lives around human habitation. And it's a very good transmitter of the West Nile virus. It can take it from our common backyard birds, house sparrows, house finches, crows, and transfer it to the human population. And we also have the preponderance of breeding sources hidden behind in the backyards, the unintended swimming pools that we don't know about, that we can't see from the street, and also the small containers or so that may be producing these mosquitoes that we don't see.
Well, in fact, Vector Control has identified beyond, above the several thousand of pools that have been abandoned in Orange County, or at least periodically abandoned, this year you've identified an additional
approximately 1,300 problematic swimming pools.
Above and beyond what you already knew to exist.
Yes, approximately 2,100 that we had on our rolls that we were investigating and servicing and controlling for mosquitoes. So this was unexpected for this year, and that to see so many that were not being, so many that were out of service.
How do you get to those pools? How do you get to those people that have those pools that they've abandoned?
The first thing we find them by doing an aerial flight of the county and match those locations with our known database of problematic pools. And from that we saw that there were approximately 1,300 on our list. We went and ground truthed them to verify that these things were also producing mosquitoes.
1,300
new pools, yes, in addition to the existing ones. And we talked to the homeowners, provide notices on it that we need to get to the backyard and inspect these pools and treat them if we find mosquitoes breeding in them.
Now, is this a health and safety issue that, I mean, does Vector Control have access to these backyards if push comes to shove and you need to get back there to be able to treat these pools you know have been abandoned and have puddles of water and they're breeding?
Yes. We're under the authority of the Health and Safety Code, where we can go in and treat the mosquitoes in there. That's all we're interested in there. We're not looking for anything else other than mosquito breeding in the problematic source. Now, mosquitoes will breed in a backyard and fly and infest the whole neighborhood and threaten the health, especially in West Nile virus year, with disease outbreaks. So this is why we have to get into the backyards, and if we cannot be granted access by the homeowner, then we do have other avenues to do that under the authority of the Health and Safety Code to control the mosquitoes in the backyard.
Okay, and have you reached out to those 1,300 additional pools that are out there this year?
Most people, overwhelmingly a majority of them, well over 90% of them, complied and gave us access to the backyard. But a relatively small percent, maybe about 5%, did not initially respond to our requests. And we have a means by which we can go to the court, put them, have the judge review them and put them on a warrant and go through the warrant process to gain access to the pool. And we notify the homeowner that you now have been served a warrant, and then within 2 days we will then request access again to your backyard.
Okay, so...
And overwhelmingly those people have complied. Occasionally we meet a few people that just insist that we we will not go in there. And we have still another step, and that is a case of a forced entry warrant, where we'll go in with law authority to take care of the problem.
Okay. Somebody has a pool out there, they're listening to this right now, they're going, okay, well, they're going to come, they've got the right to come. Can they get out ahead of it and give you guys a call and call you out?
Sure, the best thing is to contact us. We can provide a long-term solution. One of the simple things is put mosquito fish in there. And these fish will live in these dirty swimming pools. They'll live in the water there, and they will eat the immature stages of the mosquitoes. They'll live in these pools for however you provide them with water. And they can stay there for years. They reproduce in there, have new young, and they can always do the mosquito control in the backyard. Once we put them in there, we don't need to come back. We'll come back every once in a while just to check and make sure that the fish are doing their job.
And you'll come out and provide these mosquito fish free of charge?
Exactly. And the public can come to us and pick them up too and put them in by themselves into the swimming pool.
Okay.
Yeah.
Another misconception that I've heard around this year, floating around, is that, well, this year's different. West Nile is going to be ineffectual this year as a virus. We don't have to worry about it. We're in a drought. There isn't going to be enough water for enough mosquitoes to make a difference.
We make our own mosquito breeding sources often in the backyard. So either, as I mentioned earlier, just these bad swimming pools, or maybe containers that fill up with water from overwatering. Also, when we water our lawns, the water runs off from the grass into the streets. It goes in the gutters, the catch basins, and ultimately the underground drains and the drainage channels in the county. These are sites that will produce a lot of mosquitoes in there. So we still have enough water going from residential usage into these other parts of the county, infrastructure of the county, and these sites will produce mosquitoes.
How much still standing water does it take to breed larvae of mosquito population?
Less than half an inch. They can do it in very little water and survive fine in that.
Okay.
Especially if it's shaded, does not evaporate in a short period of time.
You mentioned underground water channels. We're talking about storm drains, I guess. In a drought year, we can assume that storm drains, there won't be a great deal of flow. Could storm drains be another source of large infected mosquito populations in Orange County?
Yes, from what we know, we have a list of many thousand catch basins and underground drains that are problematic as producers of mosquito larvae, just because they're in parts of the county where there's just not much drainage, not much slope at all. So whatever water goes in there, especially in these low flow periods of the year, it's just not drained. It'll pond up and then produce mosquitoes in there. Now what's difficult for us here is that we don't know where these sites are. We know where many are, but
are they inaccessible?
Inaccessible for us. Now we can find them or treat them by treating through the manhole or pulling off the manhole and seeing what's down inside there, see if there's just mosquitoes coming from that particular source.
And do mosquitoes come out?
They do, and we've seen thousands of them when we come across a new source that we don't know about. And these mosquitoes also can fly up and down the course of that underground infrastructure, breed in one place, and maybe emerge a half mile elsewhere out of the catch basins and infest the neighborhood a good distance from where they actually are produced.
Yeah. Is it impractical to think that you could actually treat these all of these drainage channels underground?
We have a method by which we control them, and because it's hard to assess how effectively our control is in all these sites. Now, we do treat them, we do measure them by trap counts after we treat them, and we show that by and large our method is effective. But the big thing are the sites that we just don't know about. And until we do enough investigations all throughout the county, can we find all these problematic underground mosquito breeding sources.
So one can say, sort of counterintuitively, that a drought condition, because of the lack of flowing water in some of these drainage areas, might account for, and fewer of these ponding areas, might account for larger pools of mosquito populations.
That's a valid assessment.
Could this explain this year's phenomenon that departs from every previous year, that this year, in fact, mosquito infection rates among mosquito populations are running in the 50, 60, 70, 80% of pools that you've tested. Could the drought be implicated in this phenomenon?
We think it's a factor, but again, there are other things involved in the whole West Nile virus dynamics. One of the biggest is bird immunity. Now, if birds have been exposed to the disease before and been infected with the virus, they should have immunity towards that, and that can dampen out infection. Now, as we've seen that our wild bird population did not have much immunity, what we use herd immunity, meaning that they did not have prior exposure to it. Prior to this year, we saw immune rates in the bird population about 5 to 6%, and 7% at best. So that's telling you that most birds, if infected, would amplify the virus and be a source of infection for other mosquitoes when bitten.
A high susceptibility.
Exactly.
Yeah.
And unlike some of our years where we've had very little West Nile virus activity, we found that the birds and their immune status has been over 20%. So again, that would be enough to dampen out a rise in infection.
I see.
So we look around the state, the drought's affecting every part of the state, but we seem to be having a higher infection rate in Orange County in our mosquito population and our human population than other parts of the state. Now, so there's other factors involved too outside of just the drought conditions. But it's certainly what we think is a contributor to it, to our outbreak of West Nile virus here. Whether you say it's the primary one or secondary, but it's certainly something that's playing a role.
The Vector Control District does not operate alone in its mitigation efforts on behalf of the county. It works closely with every single city public works and environmental agency in the county, as well as public health facilities, including the overarching Orange County Healthcare Agency. Vector staff confer with county doctors and epidemiologists on at least a weekly basis during the outbreak. Dr. Matthew Zahn is chief epidemiologist for the healthcare agency and works closely with Vector Control's Bob Cummings in trying to make sense of and looking for emergent patterns to this cyclical epidemic we call West Nile.
Sure. I think people have to realize it's very important that we get the word out to the community, and I think it's been a very aggressive and coordinated effort within the county, both from the healthcare agency, from county government. We've had city support getting word out to the community. The conversation we're having now, this helps get the word out to the community. That's the biggest thing we want to do, make sure it happens. Well, certainly the larger percentages of mosquitoes infected early on made us think we are going to have a heavy human West Nile virus season. And if you look at the numbers that we are seeing, we're going to be above 170 cases and more. Our highest previous number for a season was 79, and so there's certainly a mirror there. The amount of infection that we have seen in the mosquito pools has unfortunately borne out in the human disease that we've seen as well.
There are going to be people who are going to fall through the cracks.
Absolutely.
There are going to be doctors who are going to misdiagnose, especially in this flu season.
Absolutely.
Where it might mimic, some other form of flu.
Absolutely.
Can you make any kind of assessment of the percentage of people that are out there that might have contracted West Nile virus and become symptomatic?
Right.
Don't go to the doctor, or the doctor doesn't diagnose it? Got any kind of numbers on those people?
Well, I guess you could think about it this way. So we know that at this point we've had over 170 cases total of reports of illness. Now, of those, over 100 of those 170 are people who have had meningitis or encephalitis, okay? Is that the true number? Does that mean that 2/3 of actually the people out there who got West Nile actually had meningitis or encephalitis? Nah, it doesn't. What does it mean? It means that it's the tip of a larger iceberg. It means that for those 110 or so patients who've developed meningitis or encephalitis, we know that that's only 1% of the big pie, right? So we know that certainly that number of persons who develop just West Nile fever is much higher than the 60 or 70, numbers that we've reported. So yeah, there's a much larger number out there. I would say that people have to remember, for West Nile fever, if you just get West Nile fever and the fever goes away, you're going to be fine. You know, so it's.
Are you going to be inoculated for seasons?
Yeah, that's a
down the
good
road?
question. Seems like so. Seems like at least for years, and you know, whether that lasts 20 or 30 years or when that immunity goes away, that's hard to know. But for persons who get it, we don't see much of persons get it and then get it again in subsequent seasons.
So there is good reason for increased vigilance on the part of medical clinics,
absolutely.
hospitals, doctors'
Absolutely.
offices, to be on the lookout for West Nile.
Yeah, they have
in
to
Orange County.
realize that not only are they treating patients, and so if you can give them the answer, aha, this is the illness you have, that's helpful. But I think you're also part of a larger public health response. We work with those clinics and we work with those doctors to gather information. Then, of course, as you mentioned, we work very closely with vector control to make sure that if we are having a season of a lot more illness like we're having this year, that the vector control response, that the information that we're getting out to the community is accurate, lets them know what's going on.
Human outbreak of this mosquito-borne virus always lags behind animal infection rates, which occur earlier in the outbreak season. But also the number of human-reported infections can linger longer into the fall. Will this West Nile season be typical of previous years, or like almost every other statistic related to the 2014 outbreak, will this year be different? Will it persist longer into the fall? One wonders if there may be some other anomalies about 2014, if in fact maybe this flu season, this epidemic, West Nile epidemic season, might run a little bit longer, might run into late October, November, maybe even December, particularly with the warm weather, the drought conditions.
Right.
Do you see that as a possibility from your epidemiological point of view?
Yeah, I think West Nile season's a bit like what we say about flu season, which is if you learned one West Nile season, you've learned one West Nile season, you know, and so you get into deep water being too sure that what's happened in the past is going to be exactly like what's happened this year. Usually for West Nile, the calendar is our friend. When you start getting into October and certainly into November, the number of cases tend to go away. On the other hand, I think you said it exactly right. This season has been very different than seasons past. We know that at least through the end of September, we are seeing a lot of cases, and so certainly into October, we're going to continue to see cases. Our hope for everybody is certainly that that number starts to go away and the virus starts to go away. It will at some point, but certainly we're talking about October, you know, for those few weeks ahead. Take the precautions we should be taking to keep you from getting West Nile.
Vector Control's Jared Deaver calls it a partnership in which the public must be more than just a recipient of vector services. It must become an active participant in addressing this worst West Nile mosquito outbreak in Orange County history. Tell me how important the public is as a participant, as a stakeholder in all of this from your perspective in vector control.
Now, the one way that we know we can shorten this season in terms of the transmission of the virus is through the partnership with the public. The more engaged the public is, the more they know about our mission, and the more they know the recommendations that we need from them, what we want them to do on your own property. That's really the one way we can shorten and end the transmission of this virus. It is a shared responsibility. The vector control can only see into so many backyards, and we can only treat so many sources with our resources. It's up to every individual homeowner to do their part and to dump and drain standing water on their property, any standing water, regardless of the volume. One has to remember that even a bottle cap full of water can sustain about 100 mosquitoes every week throughout the summer months. So even a volume of water that small. So we ask that you dump and drain all of your water, do a weekly inspection around your property to ensure nothing has been refilled. Very importantly this year, to not waste our very precious natural resource, which is water. So not setting your sprinklers appropriately, not letting water run from your property into the gutters, into the underground storm drain systems where mosquitoes can breed, and then doing your part to protect you and your family, and that's keeping your window screens in good repair and or having window screens at all, and door screens, and then using those to help protect and keep the mosquitoes out of your house and feeding on you while you sleep.
With so many differences between the West Nile outbreak of 2014 and previous years, so many elevated and alarming statistics, so much focus on Orange County as the epicenter of West Nile activity in the state, Vector officials are reaching out to the public in unprecedented ways this year to take precautions. Protect your family from unnecessary exposure, your homes from mosquito intrusion, your backyards from becoming breeding grounds for mosquito larvae, and be watchful that your neighborhoods don't become hotbeds of mosquito infestation, so that next year's outbreak, which will come, is not a repeat of West Nile 2014.